Hello, my dear friends. This is Dr. Maria here, and today we will be talking about the anatomy of the dural venous sinuses. Dural venous sinuses contains between periosteal and meningeal layers of the dura mater in the brain. They receive blood from the cerebral veins and they receive cerebrospinal fluid from the subarachnoid space via arachnoid granulation. Dural venous sinuses mainly empty into the internal jugular vein. The jugular veins return blood to the heart. Let's look at the configuration of these venous sinuses. We are starting with superior sagittal sinus. This large venous sinus is located superiorly in the midline. It runs from interior to posterior in the attached border of the falx cerebri, and it ends near the internal occipital protuberance. Superior sagittal sinus connects with several other venous sinuses at the confluence of sinuses. The confluence of sinuses is the place where superior sagittal sinus, straight occipital and transverse sinuses meet. Returning to the sagittal view, we can see smaller sinus, which is located inferiorly and runs within the free border of the falx cerebri. This is the interior sagittal sinus. It drains into the straight sinus, which is formed by union of the inferior sagittal sinus and the great cerebral vein. The great cerebral vein is one of the deep cerebral veins. The other important pair of cerebral veins are internal cerebral veins. They run posteriorly to unite and join basal veins to form the great cerebral vein. The straight sinus is angled posteriorly and inferiorly and drains into the confluence of sinuses. Extending laterally from the confluence of sinuses, there are transverse sinuses. It is very common for one transverse sinus to be larger than another due to asymmetrical drainage of the blood. Transverse sinuses drain into the sigmoid sinuses. Sigmoid sinuses pass the jugular foramen to drain into the internal jugular vein. Let's talk about cavernous sinus. Cavernous sinus is an important anatomical landmark due to structures that transverse it. It is a large venous plexus situated on the both sides of the sella tursicum. The cavernous sinuses is drained by superior and inferior petrosal sinuses, and superior and inferior petrosal sinuses return blood to the transverse sinuses. Let's talk a little bit more about cavernous sinus. There are 5 nerves that pass through these sinus. They are oculomotor nerve, trochlear nerve, abducens nerve, ophthalmic nerve, and maxillar nerve, which is the second branch of the trigeminal nerve. Passing medially is the internal carotid artery. It is quite important to know because pathology here, such as metastatic tumors or thrombosis, can compress these structures and cause loss of their function. And we will be talking about it in my next video. Thank you for your attention. Stay safe and sound, and see you next time.